What if one of the greatest threats to your heart is not a hidden disease, not aging itself, and not even your lifestyle alone, but a medication sitting quietly in your home right now? A pill you trust, a pill you have taken for months, maybe years, a pill that was meant to help you ease your pain, calm your stomach, clear your nose, lift your mood, or protect your bones. Yet in some cases, these very medications may also place a dangerous burden on the heart, especially in older adults. This is not meant to frighten you into throwing your medications away. That would be the wrong response, and in some cases it could be dangerous. The goal here is not panic. The goal is awareness, because the more you understand about what goes into your body, the better prepared you are to ask the right questions, spot warning signs early, and protect your health with wisdom instead of guesswork. Many people assume that if a medication is prescribed, it must be completely safe. Others assume that if something is sold over the counter, it must be harmless. But real life is more complicated than that. Every medication has benefits, risks, side effects, and interactions. And those risks often change with age. A body at 70 does not process drugs the same way it did at 40. The heart, kidneys, blood vessels, and nervous system all become more sensitive over time. That means a medicine that once seemed perfectly manageable may become far more problematic later in life. Today, we are going to look at 5 common types of medications and supplements that may quietly strain the heart in older adults. These are not rare drugs. These are products millions of people use every day. And understanding their hidden effects could help you make one of the most important health decisions of your life. Let's begin with one of the most widely used medication groups in the world. The first category is pain relievers, known as nonsteroidal anti-inflammatory drugs, often called NSAIDs. This includes medications like ibuprofen, naproxen, and diclofenac. They are popular for a reason. They help reduce inflammation. They can ease back pain, arthritis pain, headaches, and muscle aches. For many people, they seem almost magical. The pain decreases, movement improves, and daily life becomes more manageable. But what many people do not realize is that regular NSAID use can place a serious burden on the cardiovascular system, especially after the age of 60. These medications do not only affect pain pathways, they also influence how the kidneys handle fluid and how blood vessels behave. Over time, this can lead to sodium and water retention. In simple terms, the body starts holding on to more fluid than it should. That extra fluid has to be pumped through the body by the heart. For a young and healthy heart, this may not cause immediate trouble. But for an older heart, particularly one already dealing with high blood pressure, stiffness, or reduced pumping ability, the additional workload can become dangerous. Swelling in the legs, shortness of breath, fatigue, and even heart failure can develop gradually or suddenly. NSAIDs can also cause blood vessels to constrict. When blood vessels narrow, blood pressure rises. That means these medications may work against blood pressure treatments and silently make hypertension harder to control. This is especially concerning in older adults who may already be taking medication to protect their heart and circulation. In some cases, NSAIDs can also interfere with the effect of low-dose aspirin, reducing one of the protective benefits many older adults rely on. The danger is often not in occasional use, but in routine use. Taking one of these medications every day for weeks, months, or years without a careful medical review is where problems can start to build. This does not mean nobody should ever take them. It means they should be used with caution, at the lowest effective dose, and for the shortest time necessary. For some people, safer alternatives such as topical anti-inflammatory creams, physical therapy, or other pain strategies may be better choices. The second category may surprise a lot of people because it is not a painkiller at all. It is a stomach medication, specifically proton pump inhibitors, or PPIs. These include drugs such as omeprazole, pantoprazole, and lansoprazole. They are commonly used for acid reflux, heartburn, ulcers, and stomach irritation, and they are very effective. That is why so many people start taking them and then continue for months or even years. The problem is that long-term use may come with risks that are easy to miss. One of the most important involves magnesium. Magnesium is essential for the electrical stability of the heart. It helps regulate heartbeat and supports proper muscle and nerve function. When magnesium levels fall too low, the heart's rhythm can become unstable. Stomach acid plays a role in helping the body absorb magnesium from food. When stomach acid is suppressed for long periods, magnesium absorption can drop. Over time, this may lead to low magnesium levels, sometimes without obvious symptoms at first. Then one day, a person may suddenly develop palpitations, weakness, cramps, dizziness, or an irregular heartbeat. There is also another concern. Some research has suggested that long-term PPI use may be associated with a higher risk of heart problems, possibly because of effects on blood vessel function. While scientists continue to debate exactly how strong this connection is, the pattern has raised enough concern that it should not be ignored. In addition, certain PPIs may interfere with the action of medications used to prevent blood clots in people with heart disease. These drugs can be extremely helpful when truly needed, but many people remain on them far longer than originally intended, sometimes simply because nobody ever reevaluated whether they were still necessary. If someone has been taking one for a long time, that does not mean they should suddenly stop. Stopping abruptly may cause rebound acid symptoms, but it does mean it may be wise to ask whether the dose can be reduced, whether the medication is still essential, and whether important minerals like magnesium have ever been checked. The third category is one that becomes especially relevant during cold and flu season. Oral decongestants found in many over-the-counter cold remedies. Ingredients such as pseudoephedrine and phenylephrine are designed to shrink swollen blood vessels in the nose so that breathing becomes easier. For a younger person with no cardiovascular problems, short-term use may seem harmless. But for older adults, especially those with high blood pressure or heart disease, these medications can create serious danger. The reason is simple. These drugs do not only tighten blood vessels in the nose, they can tighten blood vessels throughout the entire body. That widespread narrowing increases resistance in the circulation, which means the heart has to pump harder. As a result, blood pressure can rise sharply. In some individuals, the rise can be dramatic enough to trigger a hypertensive emergency. These medications can also stimulate the heart, increasing heart rate and sometimes provoking arrhythmias. A person may feel their heart racing, pounding, or skipping beats. They may become dizzy, anxious, or short of breath. For someone whose cardiovascular system is already fragile, this can push the body into a dangerous state very quickly. What makes this especially concerning is how easy these products are to buy. No prescription is required for many of them. People often pick them up casually, focused only on their congestion and not on what the medication may be doing to their blood pressure or heart rhythm. The packaging may contain warnings, but those warnings are often overlooked. Older adults should be especially careful with these products. In many cases, safer alternatives exist, such as saline nasal sprays, steam inhalation, humidified air, or nasal treatments that work locally instead of affecting the whole body. A stuffy nose is uncomfortable, but not nearly as dangerous as an avoidable cardiac emergency. The fourth category takes us into mental health and nerve pain treatment. Older antidepressants known as tricyclic antidepressants can still be prescribed for depression, sleep problems, or nerve-related pain. Examples include medications such as amitriptyline and imipramine. These drugs can be effective in certain situations, but in older adults, they may carry significant cardiovascular risks. One of the major problems is that they can cause a sudden drop in blood pressure when a person stands up. This is known as orthostatic hypotension. It can lead to dizziness, fainting, falls, and fractures. For older adults, even one fall can change life completely. But the concerns do not stop there. These medications can also increase resting heart rate, placing more demand on the heart over time. More importantly, they may interfere with the heart's electrical conduction system. This can show up as a prolonged QT interval on an electrocardiogram, a change associated with a higher risk of dangerous arrhythmias. In rare but serious cases, those rhythm disturbances can become life-threatening. That is why these medications are often not the first choice for older adults today when safer alternatives are available. This does not mean they are always inappropriate, but it does mean they require careful consideration, especially in people who already have heart disease, fainting episodes, low blood pressure, or multiple medications that could interact. If someone is using one of these drugs and feels dizzy when standing, unusually tired, or aware of a racing or irregular heartbeat, that should not be brushed aside. Those may be warning signs worth discussing promptly with a healthcare professional. The fifth category may be the most controversial because so many people see it as unquestionably beneficial. Calcium supplements have long been promoted for bone health, especially in older women and men concerned about osteoporosis, and calcium itself is essential. The body needs it for strong bones, proper muscle function, and nerve signaling. The issue is not calcium as a nutrient. The issue is how it is taken. When calcium comes from food, it is usually absorbed gradually. The body receives it in smaller amounts and handles it in a more balanced way. But when someone takes a large calcium supplement, especially a high dose all at once, calcium levels in the blood can rise rapidly. Some researchers have suggested that this sudden spike may contribute to calcium being deposited in artery walls instead of being directed only to bones. Over time, this process may promote arterial calcification. In other words, the arteries can become harder and less flexible. Stiff calcified arteries are more vulnerable to plaque buildup, reduced blood flow, heart attack, and stroke. Some studies have found an association between calcium supplements and increased cardiovascular risk, while others have found weaker or conflicting results, so the science is still being debated. But the concern is serious enough that calcium supplements should not be treated like harmless candy. This is especially true when people take them without medical guidance, without knowing how much calcium they already get from food, and without considering their overall heart risk. For some individuals with osteoporosis or high fracture risk, supplementation may still make sense, but the decision should be personalized. More is not always better, and a supplement that seems helpful for one body system should always be evaluated for how it may affect another. So what should you do with all of this information? First, do not stop any prescribed medication on your own. That is one of the most important points in this entire discussion. Some drugs require tapering. Others can cause rebound effects or withdrawal symptoms. Stopping abruptly may be more dangerous than continuing until you get proper medical advice. Second, take inventory. Write down everything you take. Prescription medications, over-the-counter pills, supplements, vitamins, herbal remedies, all of it. Many people are surprised when they see how long the list really is. That list can reveal patterns, interactions, and unnecessary overlap that are easy to miss in daily life. Third, bring that list to your next medical appointment and ask clear questions. Do I still need this medication? Is it still the best option for me at my age? Are there safer alternatives? Should I be monitoring my blood pressure, heart rhythm, kidney function, or mineral levels more closely? These are smart questions, not difficult questions, and they may lead to changes that significantly reduce your risk. Fourth, remember that aging changes how the body handles medication. The kidneys may clear drugs more slowly. The heart may become more sensitive to fluid overload or rhythm changes. Blood pressure regulation may become less stable. A medication that caused no trouble years ago may begin causing trouble now. Regular review matters. Finally, understand that being an informed patient is a powerful form of protection. The goal is not to fear medicine. The goal is to use medicine wisely. Some medications save lives, some improve quality of life dramatically, but every treatment should be reevaluated from time to time, especially as the body changes with age. Your heart has been working for you every second of your life. It deserves attention, caution, and respect. Sometimes the most important step you can take is not adding something new, but simply asking whether what you are already taking is still serving you safely. One honest conversation with your doctor could prevent a serious complication. One careful review of your medications could reveal a hidden burden on your heart, and one small decision made today could protect your future in a way you never expected. That is why this topic matters so much, not because every medication is dangerous, but because no medication should be taken blindly. Awareness changes everything, and when it comes to your heart, awareness could save your life.